So contraception options available. So there's the barrier method, which the things that block the connection between a sperm and an egg. So that's diaphragms, condoms. There's oral contraceptives, and those basically are medicines or hormones that prevent the body from letting go of an egg or ovulating, and it kind of disrupts the communication between the ovaries and the brain. And that's how it works, kind of fakes your body into thinking it's pregnant. Alternatives to that are the Xulane patch, the NuvaRing, and Depo-Provera. Basically, hormonal means of contraception, but not through a pill. Usually it's Depo-Provera is an injection. You get it 4 times a year. The NuvaRing's a little flexible ring that women slide inside the vagina, and it stays there for 3 weeks. They take it out, they get a light period, and they put another one in. Again, if you have memory issues, you have a busy lifestyle, these are great alternatives where you just, kind of use it and go. And then LARCs, or long-acting contraceptions, which are basically things like IUDs or intrauterine devices. There's several listed there. Those are the brand names: Mirena, Kyleena, Skyla, Paragard. Nexplanon is not exactly an IUD. That's like looks like a little matchstick that gets injected under the skin, and then it gets removed once it's done. I don't know how long does that last for, the Nexplanon, 3 years? I'm not a particular fan of that, although Dr. Saida, who wrote this slide deck, is a big fan of that. I just, don't like the concept of having something underneath my skin, but lots of women love it and swear by it. So there's a panoply of options when it comes to contraception. This is the barrier methods. You can see there on the top, those little donut-shaped domes. Those are cervical caps, diaphragms, if you will, used with spermicide. A woman inserts it into the vagina, and it blocks the cervix, which is where sperm would go through the cervix to impregnate a woman. I'm personally not a big fan of that. They're kind of messy. They work well, but not as well as the other forms of contraception. But some women, it works well for them. So it's individual preference. A little higher failure rate as well, which, when it comes to something like contraception, I want the highest efficacy I could get. So oral contraceptions, they've been around for over 50 years, one of the safest drugs on the market. And as I mentioned, they basically fool the brain into thinking the body's pregnant. It prevents ovulation. There's lots of different options. They have side effects in the first 3 months, maybe some mixed up bleeding when you're not supposed to. We call that breakthrough bleeding. Sometimes some breast tenderness or some irritability, sometimes a few pounds of weight gain, but not too much with the modern pills. The most significant side effect is a deep clot in the leg, which we call a deep venous thrombosis, and that can break away and go to the lung or the heart and cause significant complications. It's an uncommon event, but it's more common on a woman on the birth control pill. And then other risk factors, obesity, smoking, further increase that risk. So if you're going on the pill, it's preferable that you're not smoking. We won't give it to a smoker 35 and over because the risks get too high, but that's something to be aware of. Generally, there are 28 pills in a pack, and it's probably the most common option that women avail themselves to. Emergency contraception, Plan B. Some folks may have heard of it or used it in this audience. And basically, that's somebody who has unprotected sex who is not on contraception, but if they use this within 3 days of what we call coital event, that one sexual encounter, it has a significant efficacy in reducing the chance of getting pregnant. Some theorize that that burst of progesterone prevents the egg from ovulating. There are others that theorize that it prevents implantation of the fertilized egg. I think that's still debate on that, but that's generally not a preferred method because it has a higher failure rate than all the others. It has about an 80% efficacy rate. So Plan B is better than no plan, but you probably shouldn't be using this as a form of contraception. The patch, the ring, Depo-Provera, again, non-oral forms of hormonal therapy that work quite well. Depo-Provera is great for people who may have heavy periods as well. If they're concerned about weight gain, they may not be all that interested in it because it's a little bit of a higher on the weight gain scale. NuvaRing, I like it a lot, although we don't have a lot of takers for it. I think some folks just don't like the concept of putting in a tampon or putting in this little flexible ring, but it is essentially the pill in a transdermal formulation through this little ring in the vagina. And the LARCs we touched on, these Nexplanon, progesterone-containing IUDs. My favorite actually is the IUD Paragard, which is a non-hormonal one. The non-hormonal IUD works by creating what we call sterile inflammation in the uterus, a little T-shaped device like this. It's inside the uterus. And it's theorized it works by not only mechanically blocking sperm from meeting up with an egg and fertilizing it, but it creates a hostile environment for sperm. Interestingly, the IUD was developed in the Middle East centuries ago when folks going across the desert didn't want their female camels to get pregnant. So they would have an unlucky individual place stones inside the uterus of the female camels, and proven to be a very effective way of preventing pregnancy. I don't know if it was a very effective way of being safe for that individual, but that's the advent of the IUD technology. The Mirena and the other progesterone-containing IUDs, we do put them in a lot of young women who may have crampy, heavy periods and are looking for long-term contraception. So it kind of serves two purposes. Maybe about 25 to 30% of women on this IUD get no period at all. Technically, they're getting one, they just don't see it. They get like a cramp one Tuesday a month with a little bit of mucus, and that's their period. And a lot of people are real happy after the first month when they check their pregnancy test to make sure they're not pregnant. But there might be some hormonal side effects to that, breast tenderness, irritability, but it's fairly well tolerated. I already mentioned my likes and dislikes for Nexplanon, but it is very effective. And again, it lasts for 3 years. A quick office visit and injection, they put it in to get it out. It's a little tiny incision in the arm, and it's pulled out with a little clamp. But there are those who use it a lot. And that's just basically the anatomic representation of the IUD. There's a little string that comes out so patients can kind of put their finger in the vagina, feel the string to reassure themselves, oh yeah, it's still there. If somebody has an IUD and they put their finger in the vagina and they can't feel the string, then they need to come see us. Sometimes it means the uterus kind of rejected and pushed it out. A lot more often what happens is these strings just kind of migrate up into the uterus, but a quick ultrasound will tell us all good, you can go. But IUD has a very low failure rate, as does the pill, both of them under 1%. We talked about this one. That's the Paragard. It's made of copper and a plastic base. I've been on the pill for 3 years, but switched in October. I get my period for 4 days between packs. Is it normal? The question is, the answer is not anymore. In other words, when you make a switch or start a birth control pill, we give you about 3 months for your body to get used to it. So mixed up bleeding, unpredicted, or what we call breakthrough bleeding, is considered normal in the first 3 months, and we encourage patients to kind of live through it. After you get into that 4th pack, it should be perfect. And if it's not, it doesn't necessarily mean there's a problem. It could mean that, but really what it means is your pill pack is probably does not have enough estrogen in it. Estrogen kind of keeps the lining of the uterus stable. And in some women, they may metabolize estrogen a little quicker than others. So the first thing after an ultrasound to make sure everything's okay might be to either take a pill holiday, get off the pill for a month or 2, or switch to a formulation that may have a little bit more estrogen or a weaker progesterone. So it doesn't necessarily mean it's a problem, but after 3 months, it should definitely be evaluated.
So someone asked if taking birth control on and off inconsistently is bad. Just to piggyback off that, I think it depends on what you mean by on and off. So if you're on it for a year or 2 and then you're not in a relationship, you decide to come off of it for a year, I don't think that I see anything bad with that. But if you're on it for a month, off of it for a month, or on it for 3 weeks, it's not that it's bad, but you're gonna have funny bleeding, your body's never gonna get used to it, you'll have side effects without the benefits. So I think that might not be a good idea to be on and off, every month or 2. But I think if you're on for a few years, off for a few years, I don't see a reason that would be bad.
It says, I just started birth control 2 months ago and I'm bleeding in between packs. Is this normal? So it's exactly what Dr. Rubino was saying. It's okay. You can do that for 3 months and then we would want to evaluate you if you still are doing that for another month. That's sort of the initial process of starting the birth control. Your body will do that.
What do you want to say?
yeah.
And one of the things I would say is make sure if you are having that problem, you're taking it every day at the same time, because one of the most common reasons that happens, besides the first 3 months where you need to get used to it, is people are not taking it consistently, you're taking it at different times, you're missing a pill, whatever. That's going to make it more likely that you're going to have that funny bleeding, and that then no matter what pill you're on, that's not going to get better then.
And by the way, there's a common misperception that if I want to have a baby, I have to be off the pill for at least 3 months or 6 months. No, it's out of your body basically in 24 hours. That's why you have to take it every day. And sometimes if you're on a very low dose pill and you miss it, you could conceive. So the pill is metabolized quite quickly in humans, so it doesn't have a long-lasting effect.
What happens if you get PMS symptoms after getting your period? So PMS, for anyone who doesn't know, it's irritability, headaches, anything that comes regularly in terms of monthly cycles. So short story short, so menstrual cycles it's estrogen and progesterone. So any kind of rise or fall in that can affect the way that you feel, the moods. I would say that if the different mood changes affect the way that you feel, and either it affects your social life, you feel really depressed, then those are times when you should see somebody for help in terms of for treatment for depression. But you can have symptoms after getting your period. That's normal. And then the second question is, do you need a separate razor to shave pubic hair? Anyone want to answer that? Nope. Okay.
As long as it's not someone else's razor.
Is going from a heavy period off, not on birth control pills, to a light 4-day period on birth control pills, is that normal?
I would say it's normal, and it takes some people sort of months to get there, and that's the side effects they want. So I would say 4 days and lighter is a good thing. That's what you went on it for, and hopefully you're finding some benefit. We have women who are in their late 40s who are not necessarily taking birth control to prevent pregnancy. They're taking it for that exact reason, and they wish that within a month they would get better that quick, So I think it sounds pretty normal.
I see 2 gentlemen in the room. And actually, when I started my career, it was about 80% men in OBGYN and 20% women. Now it's the reverse, and I see that reflected in this room. Any questions from the gentlemen in the room? All right. Women's health care, by the way, fabulous field, just so you know if you have an interest. The question is, can you take birth control pills continuously? In other words, take the first 3 weeks of it instead of going to the last 7 days of what we call placebo pills, skipping those and going right to another active pack to delay your period for 3 more weeks. Any panelists want to take that?
Yeah, that is something that is routinely done. So for the woman who has that horrible period that you just never, ever, ever want to get it, you can do that. And then you don't have to get your period. The standard way to do that is to do your pills continuously for 3 months, and then do the withdrawal bleed, then get your period once every 3 months. And so you can avoid having that horrible, painful PMS period. You'll only get it 4 times a year instead of every month.
And I might add to that, just so women are clear on it, the period that you get on the pill is artificial. It is, the drug companies actually started the birth control pill with progesterone only. Early in test marketing, people were freaking out because they weren't getting a pill. So some smart pharmacologists said, well, if we add a little bit of estrogen, that'll build a little fake lining, and we'll withdraw, as Dr. Abasels mentioned, the withdrawal bleed, we withdraw the estrogen after 3 weeks, then they'll shed a little lining. It's entirely normal to not get your period on the pill over time because your lining thins out or you take it continuously. Whole different ball game if you're not on the pill and over time your period stops and you're not pregnant. That needs an evaluation. But not getting your period when you're on the pill, especially if you're doing it purposely, it's perfectly safe to do because that's an artificial lining to begin with. The question is, if you're taking the pill and you miss a few days, is it okay to kind of catch up and take the pills that you missed?
So if you're not doing it too regularly, meaning you're not taking your pill for a couple of days, you can always double up when you do remember. So say if you miss one day, you can double up on the next day and take 2 pills. But if it's something that's going to happen regularly, then you probably want to try a different form of birth control. If you're using birth control to prevent pregnancies, then even missing 2 or 3 days or here and there would make the pill less effective. So for that reason, usually I recommend getting an IUD. That way you don't have to remember to take a pill every day. Or like Nexplanon, something else, or a shot. Should I take a lot of birth control pill if I want to use it instead of Plan B? Okay, so the medication in the birth control pill is similar to the Plan B, but I would say that we wouldn't recommend that. Using different dosages of medication isn't great if it's not prescribed by a physician. I was just wondering, so in terms of your health center or student health, do they supply condoms for free? Yeah. Good. That's great. And then in terms of, for women in general, or anyone, if you are under the age of 18 or 16, you can visit a OBGYN to get contraception or birth control. So in case if any of you have younger siblings or are interested in that, they don't need parental, permission. Yeah.